My name is Miranda. I'm a helpline specialist with Komen. So I've been with Komen for a little bit over a year now. As of this coming January, I'll have had 7 years of oncology experience. So prior to Komen, I did work in the field as an oncology social worker, working with patients, working with families, working with caregivers. I feel like that experience was very invaluable for me to really understand where patients and caregivers come from. And I still hear from patients and caregivers today, but today in particular is special for me because I'm in person and I get to actually connect with caregivers and family members and those living with MBC. So if that applies to anybody in this room, thank you for being here. Anybody else too, there's still going to be a lot of great information that we're going to be sharing. Stephanie here is also a member of our patient care center team here at Komen. She's a patient navigator, so she does have her contact information as well as some other resources. All of the resources that I share in the presentation are also going to be listed on that handout. So try to make it easy for you all so that way you didn't have to try to take notes. But of course, if you have questions, you have concerns, our contacts are on there. I'm going to talk briefly towards the end about our patient care center programming, at the very least our helpline, because I know that that's been mentioned a few times already today. Okay. And I encourage any of you, if you have questions or comments as we go along, just feel free to raise your hand and we can go over those. All right, so I wanted to start here. So this came from the Washington Post, but in the desperate race for cancer cures, I also hope that doctors, politicians, and scientists will remember to look to the dark side of that moon, where the caregivers live, and find a way to ease their journey. This comes from Karen, who's a caregiver herself for her husband with cancer. And what Karen is referencing here is the Moonshot Initiative, which is coming from the White House by the year 2047. The idea is through funding, through advocacy, through research, to make the lives of those living with cancer more manageable and to prevent more cancer deaths. And what Karen is saying here is like, that's great, but what about the caregivers too? You know, we feel like caregivers oftentimes are the unsung heroes of many patients' journeys. If a patient is lucky enough to have a caregiver on their side, caregivers, their role can be very complex and can also be very overwhelming for them, which is what the focus of today's presentation is. Okay, so a caregiver wears many hats, as you all may know. And I think first, just to define what a caregiver is. So a caregiver can really be anybody. It can be a family member, it can even be a friend or a neighbor. And I find a lot of times for somebody who's a caregiver for someone with MBC, they can also be a caregiver for somebody else too. So maybe they are helping to take care of their mom who has MBC, but they also have young children. Or maybe they're taking care of their spouse, but they also have a parent that needs their help too. So sometimes it can be this dual role of caregiving for multiple people. And as a caregiver, especially for somebody caring for somebody with MBC, there can be so many different facets of care. And just for the sake of time, I'll quickly go over those, but it can be clinical. Having to learn all this clinical jargon and understand the diagnosis and treatment, communicating with medical professionals, taking down notes, like you quickly become a secretary, you become the advocate, you become the billing specialist, sometimes you're the chauffeur. It's a lot of different roles that you take on as the caregiver. You know, practical too, helping them with mobility, driving them to appointments, sometimes bathing, doing more work around the house. And maybe that's something that you really didn't need to do before this diagnosis. And of course, the emotional aspect of that, providing support, companionship, just being there, listening to the patient, and the advocacy piece as well, which we'll talk more about. So we have this imagery of caregivers wearing many hats, but also sometimes it can feel like wearing a mask. There's more research being done on this, but caregiving can be very traumatic. Sometimes just walking that journey with the patient, being witness to medical episodes or symptoms, being in the hospital or in emergency room settings, that can be very traumatic. Maybe seeing this person that you are now taking care of and all of the changes that go along with that, with their diagnosis and treatment. So we're seeing more and more about the trauma that caregivers, specifically of those with cancer and with MBC, are dealing with. We're also seeing research about mental health in caregivers, specifically with cancer, or specifically for those that assist those with cancer. So now 50% of those caregivers are reporting having an anxiety disorder, 40% are reporting depression, and 75% are reporting sleep disturbances. So it's normal to have anxiety and depression when it comes to caregiving. But we're still not seeing enough caregivers reaching out for support. We'll talk a little bit more about that. Okay, and I just wanted to talk kind of positively also, so about trauma and caregivers. This is a newer study out of March 2022, and what this indicates here is that although cancer is a traumatic experience for both patients and their families, positive outcomes may emerge by channeling the pain from such a traumatic experience into positive, productive, and meaningful growth through finding meaning in the experience. So, and important to note with this too, the dynamic between the caregiver and the individual with MBC, it doesn't necessarily have to be a positive relationship either. Sometimes the relationship between those two may have already been strained prior to the diagnosis, or maybe there's cultural factors into play here where there's more of an obligation to take care of this person, and it may not be a loving relationship. But even so, this study is finding for those individuals, there is still some positive outcomes for those folks. That through taking care of this person, even if it is a strained relationship, there might be some form of meaning that they're getting from this. Some people have been able to find their voice or find their strength from this relationship and from this role that they take on. Okay, so I'm struggling and or my loved one is struggling, and oftentimes these are intertwined. What can you do? We're going to talk a bit about these things. So first off, checking in with yourself, asking for help, and modifying plans, being flexible. So check in and know yourself. Sometimes you need to ask yourself these questions. Take a break and ask, like, what do I need right now? Why am I feeling so overwhelmed? Do I need someone to listen to me? Is it financial assistance that we're struggling for? It's no surprise that financial toxicity is a huge issue for folks living with MBC and their families. And when basic needs aren't being met, it's like, how is the mental health piece going to be met? So that's important to note. Maybe it's needing help caring for my loved one. There's just not enough time in the day, and I feel like I need to think outside the box and reach out and get some help. And a few things here too. So knowing your own strengths and limitations as a caregiver. You know, what are you good at and what are you not good at? Maybe you've never been the type to go and make dinner every night, and now the individual you're taking care of is no longer able to do that. Maybe that's an opportunity to reach out and have some other folks help with dinner. And setting boundaries for what you are and are not able to help with. So being honest with yourself, I'm like, yeah, it's just not going to be me. I'm not the type to go to the grocery store and shop and do this. You can certainly try, but there are some resources we're going to be talking about too in order to help with those types of things. Recognizing when you need a break and prioritizing your own needs as best as you can. And again, it's that symbiotic relationship. Like the more you take care of yourself, the more you're able to take care of that other individual. I know that's said a lot of times, but it is so true. Okay, so asking for help, which is much easier said than done, creating a network of positive support. And I think the key word here is quality support. We're going to be talking a little bit later about how sometimes support from other people may not be very helpful and in some cases may be even hurtful. So I think really trying to find out who your tribe is, who are those people that you can rely on is important when facing a diagnosis. There are some tools online as well. This can be helpful for some people. If it's just another thing to add to your plate, then certainly you don't need to access these resources. But there are these free online tools where you can organize group calendars for folks in your community, neighborhood, family that can help with support visits, meal train, scheduling appointments, helping with transportation. Okay. Next, we have support groups, peer support, professional counseling. We were just speaking with an individual here before. We were talking about how so many of the support groups nowadays are geared towards folks stage 0 through 3, which is great. But at the same time, there's still such a need for not only folks with MBC to be able to get their own specific support, but also the caregivers as well. We're seeing some caregiving support more and more, but it's still an unmet need. And again, for those that are trickling in, we do have a handout with resources. So any of the resources that are discussed in the slide will also be on the handout. So that way you can access them later on. Okay, and asking for help too with respite services. And honestly, respite is difficult to access. And I think it really comes down to where you live and your ability to pay. Sometimes it's a covered benefit through your insurance company. Sometimes it depends on if there's a medical need or not. Sometimes it's just not covered. So there are some resources, again, on the flyer that you'll find when it comes to finding additional care for the individual. Home health care too, skilled care services. And again, this is really a conversation to be had with the medical care team. I know earlier today we talked about, it's not just the oncologist, that there's many different factors going into the medical care team and different specialties as well. So whether that's palliative care, if it's a nurse navigator, somebody that might be able to direct you to some of those services that can be ordered through the physician's office. Okay, and legal and financial matters, just to briefly go over these few. So Triage Cancer and Cancer Legal Resource Center, they both offer free support for not only cancer patients, but also the caregivers as well. So as caregivers, sometimes that means taking time off of work, needing FMLA. Sometimes that means advanced directives and working with the patient, making sure that these things are proactively taken care of, and also repeatedly having those conversations as well. Not just a one and done, like let's do the advanced healthcare directive. Maybe that's something to go back periodically and review to make sure that the goals are still the same for that individual. So Triage Cancer, Cancer Legal Resource Center, we commonly refer to those. And again, they're free resources. $4, a newer organization, but they do help folks navigate medical debt. So I know oftentimes the caregiver can be the one that is going over the bills. So that also might be something to keep in mind as well. Okay, and modifying plans as well. So setting boundaries with other loved ones. I think mostly people's intentions are positive and wanting to be helpful. And I think that there's only so much time in the day for folks to be on the phone updating other individuals, other loved ones about what's going on with the individual's condition. So sometimes it can be helpful to establish like a communication tree where you tell one person, it's like, hey, can you disseminate this information to everybody else? So I don't have to be on the phone all day. Maybe that time can be used towards other things like calling the insurance company or practicing self-care. Those other resources I mentioned earlier, lots of helping hands can be helpful for that as well. And I think also from an emotional standpoint, not feeling obligated to respond back to each text or email. Maybe if it's a text, you can react or send an emoji or something to show that, hey, I'm reading this, and I'll get to you when I can. And it's still helpful to get those messages of support. But understandably so, it's okay to also not have it in you to respond immediately back to those folks. And if you aren't feeling up to making that phone call today, it's okay as well. I also think prioritizing in-person visits from individuals that the patient themselves wants to see is important. If the patient is not being asked, do you want to see this person? That might be something to keep in mind as well. Setting those boundaries with people that might not really be helpful for them to see during their journey, and be prepared to receive unsolicited and perhaps unhelpful advice. I think that just goes with life, with anything, but specifically with a cancer diagnosis, I know from speaking with folks on the helpline, sometimes you'll hear, oh, well, I know so-and-so had breast cancer and this is what they went through. And as we've heard today, breast cancer can look so differently from each person. So it might not be helpful to hear about their experience if, say, they were stage 0 DCIS versus somebody with stage 4 metastatic breast cancer. And in terms of the caregiving part of that as well, so sometimes saying things like, well, you need to be strong for so-and-so, it doesn't necessarily need to be said, right? Like they're already doing the best that they can to be strong for that person. And this is very subjective too. So I think if I had some advice in terms of supporting somebody who's a caregiver, is first off just listening. Sometimes we want to come up with the right thing to say, and there might not be that right thing to say. Just giving them that space to listen. And I think also validating their feelings, that this is overwhelming, that this is scary. What can I do for you today? And I challenge caregivers, if there's any in this room, to take them up on that help. If this is a trusted individual, give them at least one actionable task that they can do. Maybe it's going to the grocery store and shopping. Maybe it's picking up that prescription. Maybe it's picking up your son from school. Something that they can do to take some of this off of your plate. Okay. All right. And then again, these resources are mentioned on here as well, which we did talk about briefly today in some of the other sessions. But these are helpful when it comes to not even necessarily end-of-life care, but care throughout the MBC individual's journey. So advanced directives, palliative care, getpalliativecare.org is helpful just to kind of demystify some of the information that's out there, what palliative care is and how you can access it. We talked also today about clinical trials a bit, and we're also going to be talking a little bit about our helpline, but just know that there is a specific clinical trial search online, and which is listed on there, as well as the Metastatic Trial Talk. So that's a newsletter that's sent out electronically via email. I think that's really helpful because you'll find anything and everything on the internet, right? Not everything is accurate. So that might be a way for you to be able to get the most up-to-date, accurate information sent to your mailbox or email box, knowing that it's legitimate. It's coming from Metastatic Trial Talk, which specializes in metastatic cancer. And MBC Brain Meds as well offers support to those that are MBC to the brain. And above all, communication is key, right? In any working relationship, and I know we talked a little bit before about the dynamics of the relationship, even if it's not the most positive relationship between the caregiver and the individual with MBC, still communication is important, and that can really help to clear any misunderstandings, know where the patient is coming from and what their expectations are, and also, too, including your loved one in fun and meaningful activities, too. I know we have some other groups going on today for patients, which I think is great, but just know, too, with a diagnosis of MBC, life goes on around them, too, right? Like they still have things that they like to do, people that they want to see. And it's important to have that conversation with them to see what it is that they want to work on. And briefly, I just wanted to spend a few minutes to talk about our Komen helpline. We do have the contact listed there. Helpline is where I work. So it really can be anybody that's needing to access breast health care. It can be folks that are diagnosed. It can be caregivers themselves or family members reaching out. Really what we're doing is we're trained specialists. So we provide that listening ear for folks if they need that time to process their diagnosis, ask questions. We're not clinical, but we can provide some general health information for them. And also direct them to some other resources. We also have questions to ask your doctor listed on our website as well that we encourage folks to include their medical care team in that conversation. clinical trials information so we can help you to find a clinical trial that works for you. We also do have a financial assistance program. So just to give you all an idea, for eligible patients that are stage 4, it is a $750 grant that we currently offer to those folks. We also do have a patient navigation program. Stephanie is one of our patient navigators. So if the patient calls the helpline and if they're just looking for some information or from like just a one and done support call, that's where we come in. But our patient navigation is really there to provide that individualized long-term support. And know that they commonly work with caregivers as well. So we definitely want caregivers to feel comfortable to reach out to us. We also, again, help folks that are just accessing breast healthcare issues, some of those issues that we heard about earlier today from our other speaker, helping them access those programs and overcome those barriers. This more or less goes over our Komen Helpline. And then we do have some of those other resources listed. For the sake of time, again, they're on the handout here. And I did just want to say thank you for taking the time to come in today and hear about some resources. And thank you for all you do as caregivers. We know that it's an overwhelming task, some of the data that we talked about before, but we're here to support you as you need as well. Thank you all so much. Take care.